So now she's confirmed having inguinal hernia. What is the next step, doctor?
So if there's hernia, we worry about complications of hernia. So with the hernia, intestine or fat can come through or the ovary can come through. In a girl, then the intestine can be strangulated by the hernia or the ovary can be strangulated. That can reduce the blood supply to the intestine or the ovary, and those structures can either shrink or can die, which is the worst case scenario. In terms of the risk of complication of intestine getting stuck or the ovary getting stuck, the risk is quite high. The risk of hernia operations is minimal. So we're looking at anesthetic risk and the operation risk. This is minimal because it's a very safe and commonly performed procedure. So anytime we are deciding on surgery, we look at risk of not doing anything and risk of the surgery itself. So we look at the balance, and often the risk of doing surgery is much less than the risk of not doing anything. So that's the decision-making process. Is the hernia going to disappear by itself? No. If it doesn't, what's the risk of anything happening? The longer you wait, the longer you have potential of complications happening to the child. So we want to reduce that.
But I'm a bit worried about the surgery for her age now. How is it, doctor?
So this day and age, anesthesia is completely safe. In terms of the surgery itself, we'll do laparoscopic surgery, which is the best thing for girls with hernia and boys as well, but more importantly girls, because when you put the camera inside, a small cut is made in the tummy, in the belly button, and 2 other small scratches. And everything is done under vision. It's very safe. Risk of bleeding is minimal. Risk of infection is minimal because the cuts are small. And the only risk is potentially it can recur, but the recurrence rate is also very small. So for a 4 or 5-year-old child, the risk is hardly anything. Yeah, so I won't worry about it because we do surgery on newborn babies as well. And premature babies who are in the NICU and ICU for babies, when they get to term and they're about to be discharged, we do the operation then. So they may be 2 kilos as well. So the risk of those patients also is quite small. So compared to them and older child, the risk is even less. Yeah.